Today, and item 3, SB 1006 by Senator Wolk is first on the agenda. Please join us. Oh, thank you.
Thank you, Madam Chair.
Good morning.
Good morning. I bring to you SB 1006, which is a measure to establish a new firearm violence research center at the University of California. Research into gun-related injury, violence, or death was once the responsibility of the Center for Disease Control and Prevention, the CDC, and was funded by the federal government, along with research on other public health issues, including diseases, accidental injuries and deaths, food safety, environmental health, and others. However, in 1996, at the request of the National Rifle Association, Congress passed the Dickey Amendment, which was named for Congressman J. Dickey, a Republican from Arkansas, and that put an end to firearm research at the CDC. As a result, there are many important questions asked which remain unanswered. We as policymakers are often left with insufficient data and evidence to determine the most effective policy to reduce the number of deaths and injuries resulting from firearm violence. Fortunately, California is well situated to fill this research gap. We have the capacity to do what Congress has failed to do: get the facts, apply sound scientific methods, and find answers that will lead to better policies and solutions. Support for more firearm violence research is strong, and ironically includes the author of the Dickey Amendment, J. Dickey himself. He has come out strongly in favor of more research, including SB 1006. And let me quote from his letter, which he co-authored, ironically again, with Mark Rosenberg, who was the former director of CDC's National Center for Injury Prevention and Control, and whose research was stopped by this amendment. Former Congressman Dickey says, and I quote, "Our nation does not have to choose between reducing gun violence injuries and safeguarding gun ownership. States can serve as democracy's laboratories for firearm violence prevention research, as they do for other major health and social problems. This is particularly true for California, where well-qualified researchers already work with uniquely rich and valuable data on research that simply cannot be done elsewhere. This effort is co-sponsored by the California College of Emergency Physicians and the American Academy of Pediatrics. We have strong support from the public health community, from law enforcement, and a growing list of bipartisan co-authors in the legislature. I ask for your aye vote."
Thank you. Let's call the roll. I think we have a quorum.
Lou.
Here.
Block. Hancock. Huff. Leyva.
Here.
Leyva here. Mendoza.
Here.
Mendoza here. Monning. Pan.
Here.
Pan here. Vidak.
Here.
Vidak here.
Okay. All right. Thank you. We have a quorum. Okay. In support of the bill, please.
Good morning. Thank you, committee members. My name is Kevin Jones, and I'm an emergency physician speaking on behalf of the California chapter of the American College of Emergency Physicians. As a physician, I rely heavily on scientific research to formulate positions on public health issues and how to approach and treat my patients and their disease process. So, for example, in 1996, the research done on stroke care and prevention up until this point has led to a 33% reduction in mortality for stroke patients. In 1996, as we know, the federal funding for research, though, on firearm violence was eliminated, and since then we have seen the effects of this. In 2014, there were nearly 3,000 firearm deaths in California, and that same year there were nearly 5,000 emergency department visits for involving firearms that same year. It goes without saying that as an emergency physician, we see the impact of firearm violence regularly, and all too often we are the ones who have to tell family and loved ones about the death as the result of a firearm. We also see firsthand the profound physical and psychological damage that firearm violence inflicts on its victims and families, and the enormous toll it takes on our neighborhoods, hospitals, and law enforcement. And just as we approach medicine through research, much like in stroke care, we believe the impact of firearm violence should be studied to help identify areas of reform and other interventions to reduce firearm violence. And California is in a position to do that with this bill. This bill is needed to give the lack of federal funding since 1996. The UC Center for Firearm Violence Research could fund studies looking at evaluating existing policies or assessing potential firearm violence measures. I believe that more research will allow the legislator to make more informed policy decisions. That in turn will help me to hopefully in the future not have to console more family members as a result of victims of firearm violence. Thank you.
Thank you. Others in support?
Yeah, hi, my name is Dr. Dean Blumberg. I'm Associate Professor of Pediatrics at UC Davis Medical Center, but I want to make clear I'm not testifying on behalf of UC. I'm testifying on behalf of American Academy of Pediatrics in California, co-sponsor of this bill, and this is a priority for us. This is the only bill that we are co-sponsoring currently, and it's important for the lives of the youth in California. I'd like to introduce my colleague, Dr. Lindsay Harms, one of the residents that I work with, to speak on our behalf.
I
Thank
would
you.
like to state that I'm representing the AAP in California, which is 5,000 pediatricians, both general and subspecialists. And I wanted to,
Bring the microphone a little closer to you
okay,
so we can hear you.
thank you. I just wanted to talk very briefly about how pervasive gun violence is for our pediatric patients, both in the way that's reflected in our statistics and ways that we can't quantify. So in my very brief experience as a pediatrician in California, I have already seen members of the nursery, newborn babies whose parents are affected by gun violence, and in particular, a family that cannot go back to the support of their family in a different state because they're a victim of gun violence. I've seen children in orthopedic clinics who have growth plate problems because of accidental firearms, and while we know that children under the age of 15 are 9 times more likely to die in accidental gun violent accidents, they also have effects that are different just from death that we don't quantify as well. I've seen patients in the juvenile hall setting who have gun violence more prevalent in their families than they do heart disease, who think that 2 shots to the abdomen is more common than a heart attack. And in our country right now, children between 5 and 14 are 17 times more likely to be murdered by firearm violence than in other industrialized nations. And most particularly for me, I've seen, counseled, worked with, and then grieved the loss of teenagers who have committed suicide by firearms. And right now, that's reflected in our statistics that teens are 10 times on average more likely to commit suicide with firearms than other nations. So while my experiences make me very passionate about the importance of gun violence, they don't make me better equipped to address prevalence. And I would much address prevention. I would rather be able to prevent than to do damage control for these families. And I see this every day as a pediatrician. I thank you for your support of this, and I urge you to support this bill 1006 as well.
Thank you very much. Others in support of the bill?
My name is Nick Wilcox. I'm representing the 27 chapters of the Brady Campaign to Prevent Gun Violence in California. We view gun violence as a public health issue. Public health issues are amenable to solutions based upon good science and research, and therefore we support this bill. We believe that it is a national embarrassment that at the federal level we cannot do research on this issue. It's somewhat of a sad commentary that California has to take the lead in this, but we are the biggest state in the nation, and we can begin to make a dent in this and try and lead our policymakers in the correct direction. Thank you.
Thank you very much. In support of the bill, anyone else? Okay, is there opposition to the bill? So would someone get up so we can hear the opposition, please?
Madam Chair, I also have Dr. Wintemute, who is here to answer any questions.
Okay,
From
thank
UC
you.
Davis Med School.
Good morning.
Good morning. Madam Chair, members of the committee, Ed Wardy with the National Rifle Association. Want to come by and thank you for taking up this issue. It's a very complex issue sometimes, but we in the National Rifle Association don't oppose research. That's not the fundamental question here. Through my years here at NRA in 25 years, I've seen many skewed reports of so-called research that have taken place. research that hasn't taken into account all the different axes and all the different things that contribute to this. Our concerns, even at the federal level, there's been comments made here that the federal government is prohibited from doing research. No, they're not. Nothing in federal law prohibits the federal government from doing any research that they want to do. What prohibits them is from using taxpayer money to do it. There are millions and millions of dollars laying around here in the state of California in grants that can be given to anybody, university who wants to do any studies they want to do. Part of our concern is that we've seen bias studies time and time again from some researchers at UC Davis, who, when you watch what they do on the internet and when you watch their dialogue, they already have a preconceived notion of what they're going to try to quote unquote prove. My background, which inhibits me, is I have an engineering background. And I was taught as an engineer, data drives the science. But also you have to ask the right questions. When you do research, you don't go out and make a conclusion and then drive the research to get your conclusion. What you do is you observe what's happening, you take into all the account all the different variables that lead to the symptomatic thing that you're seeing. Then real research, what they do is they take all the factors involved and what could cause that problem, and you take an unbiased, objective look at all the things that contribute to what's going on. Our concern is there are people in the quote research industry out here in California that already have predetermined things that they want to do with their research. And that is not science. Science is a subjective, non-biased look at data and the things that are going on, taking those issues aside, taking politics completely out of it, and looking at the data.
Okay.
So if you want to have a bill, we could support a bill that's non-biased and totally subjective, that asks the questions. There are many things that factor into this. I came from an extremely poor background. We were a welfare family. My mom worked as a nurse nights. I was called a latchkey kid today. My mom would I'd come home from school, she'd make us dinner, make sure we did our homework. She would go then and do her nursing rounds at night and come back in the morning and get us up for school and take us to school. So I understand what we're talking about here. But the thing I tell you is that the research that needs to be done needs to be completely, totally unbiased. You need to have some kind of peer review group look at who the researchers are doing and what they've done. You need to have a non-biased group of people who are professionals at looking at the data, whether it's a social matrix you're looking at, whether it's economics you're looking at. If you looked at and listened to the research today that people are talking about, I am supposed to be a violent person because of my background. Coming from a single parent home, which is extremely poor, I'm the only person in my family who's ever been to college. So if you look at some of the social norms that they talk about today, some of the social research that's gone on, and when it comes to gun violence that they talk about, is that I don't fit the norm, okay? So we in NRA want to look at stringent, unbiased, all-inclusive evaluations of the laws that are working. Because what we've seen from the research I've seen in the past is they have an agenda of a gun or type of gun they want to ban. Let me give you an example. There was a research that was done a long time ago talking about the ring of fire guns that were inexpensive handguns. What was the problem with the guns is they were inexpensive so people could afford to buy them. So the researcher created a study called the Ring of Fire study, where they went out and modeled the data and took the data and came up with the conclusion they wanted. Going back to my engineering background, I was taught in aerospace engineering that the data drives everything. Data doesn't lie, science doesn't lie. The facts are the facts. We've seen research out here in California on different issues, like the lead ammo issue. We did a Public Records Act request on a researcher from UC Santa Cruz talking about non-biased research theoretically, where they admitted in their emails back and forth to each other in the Department of Justice and the Department of Fish and Game that their data, quote unquote, did not fit their model. Well, that's called science. So I would recommend that the committee look at this bill, stringently look at the bill, require that the promulgation of the bill and any money that the taxpayers give to this bill has to be unbiased, stringently looked at, has to be peer reviewed before the research is done, because you need to ask the right questions before you do the research. Just randomly throwing money at researchers and saying, go and give me a conclusion. It's not science. And it's also a waste of taxpayer dollars. So that is one of the reasons why we oppose the bill today, Madam Chair. Thank you very much.
Thank you very much. Senator Monning? Oh, I'm sorry. Is there another witness opposed to the bill?
Yes, ma'am.
Okay.
Madam Chairman, members of the committee, Chairwoman. Sam Peretta is representing gun owners of California, and I apologize for coming in so rushed. But I wanted to make sure that you understood that when the argument is made that the Center for Disease Control has been banned from conducting studies, that nothing can be further from the truth. As a matter of fact, they have raised money and have done studies on gun violence multiple times within the present parameters that they have, and the parameters are that the Congress has said, we will not use taxpayer dollars to promote anti-gun research. Well, in fact, CDC has conducted several studies, including one that, two that were released last year, and the results of those studies weren't such that the people who were requesting them liked the results, because they indicated that gun control had very little impact on the gun violence issues that they were trying to study. So the fact that CDC has a ban, that doesn't exist. Our concern, as was pointed out by Mr. Worley and the National Rifle Association, is that we are not afraid of honest, good research. What we are concerned with is that information that is put out as research that is invalid. Just recently, a report was put out by the University of Boston, which even some of the people that we deem to be not friendly to the Second Amendment in the research community have pointed out that it was basically grossly negligent, and the information that was put forth as research that is quoted by lawmakers and by the media as being faulty. So our concern is about honest, good, fair research. We're not afraid of that. Whether the state of California should be paying for that through taxpayer dollars, we don't think that's necessary. We think that there is enough. There are enough resources out there in order to fund these kinds of studies by anybody who wants to do them. They pop up all the time. So that's our position. We oppose this bill. Thank you.
Thank you very much. Anyone else opposed to the bill? Questions from members. Senator Monning, then Senator Mendoza, and Senator Pan.
Thank you, Madam Chair. I want to thank the author for bringing this forward. It's interesting, the suggestion that investigation of a public health threat should not be supported with public dollars when the results of gun violence and gun deaths has strained our public resources in terms of emergency medical services, protracted medical support for survivors. One of the opponents suggested that we should focus on facts, and a fact that I find staggering and should place this in the realm of public health epidemic: more Americans have died from guns since 1970 than all Americans in all wars, including the Civil War, on battlefields. That is a public health epidemic. I want to thank the author for bringing this forward, and I would suggest that those who fear biased data, if you go to private sources to fund your research, you're more likely to get a biased interest from the funding source than from using appropriate government resources, looking at this from a neutral position as a public health crisis. So I guess not so much as a question as a commentary, but I want to thank the author, and maybe to conclude with a question for the author. Senator Wolk, what is your intent in terms of the structure of this research? Is it fair to assume that you would expect unbiased research, even if it were funded with public money?
Thank you, Senator Monning, for your comments and your question. Indeed, we are very clear in the bill as to the purposes of this research facility, and we are very clear about the peer review process and the steps that are essential to doing good research. The intent is to reduce the incidence of injury and death that comes from firearm violence. That is the intent, and I make the analogy to cars and automobiles. When cars started to be used, the purchase of cars and the use of cars in the 60s and 70s, there were a large incidence, great incidence of death and injury stemming from accidents. The research that then began to be finished or done yielded some excellent suggestions for example, seatbelts, child seats, different kinds of glass, different kinds of bumpers. I mean, I could go on and on. It didn't suggest that cars be banned. That was not on the table, frankly. But these other policy suggestions that were put forward and enacted, in fact, reduced the incidence of death and injury dramatically. And we are the beneficiaries of all of that. So that's how I see there is an exact analogy, it seems to me, to guns. For the moment, the Supreme Court is clear through the Heller decision about the Second Amendment. This is not about reviewing or revising the Heller decision. This is about taking a look at the injuries, whether there are patterns that would suggest better policies, whether our existing laws are in fact effective, and if not, what would make them more effective, or perhaps we should put them aside and go in a different direction. It seems to me that that is what we want our research at the University of California to do. And you do it according to all of the standards put forward by the National Institutes of Health about good research. And I was hoping Dr. Pan would talk more about the research. But I want to thank you for the question.
Senator Mendoza.
Thank you, Senator Walk, for bringing this measure forward. I agree with it. I was looking over some of the points that you're going to be asking for to be researched, whether it be the nature and the consequences of firearm violence and scientific evidence behind it, identifies and implements innovative prevention policies. You're talking about recruits and provides specialized training opportunities. But California has some of the most innovative or stringent gun laws in the country. And I think for the most part, I think could be our model for other states. But in this bill, you don't have anything you don't have any part of that as part of your research. You don't have a point that says identify and implement responsible gun ownership or responsible gun control laws. Or maybe can you add specifically a part of your bill to make sure that that is covered, to make sure that we look at the existing laws that we have so that responsible gun owners right now in California are saying, look, we abide by the laws, we have our own guns, this works for us, it should work for the rest of the country. You see what I'm saying? Or maybe some parts of that might not work, and so maybe you could add that as part of this legislation?
It is our intent that that be the case.
But it doesn't say it.
We would be very much willing to consider language that makes it very clear that
Yes.
that is what we're trying to do.
That would
One
be
of
great.
the things we're trying
Yeah, that's fine. All the other things I agree with, and I think it'd be great to have a scientific approach to it and have an unbiased and perspective from researchers, but also look at our existing laws, gun control laws that we have in California, and see how does it work, how does it compare, what maybe we delete some, add others, I mean, whatever. So that would be kind of nice for all of us to kind of understand how our laws compared to other states, and that kind of research is also needed. And I would love to have that as part of this package, if you could add that.
We will clarify and make clear that that's included. That is our intent.
Thank you so much.
Thank you, Senator.
Dr. Pan.
Thanks very much, Madam Chair. Senator Walker, I want to thank you so much for bringing this bill forward. And certainly as a former UC faculty member who worked on research, it's very important that we understand what's going on in our communities we know from a public health standpoint, just from looking at the data that we currently have, which is limited, but that there are many families are affected. There have been many deaths. I think that your analogy to looking at how to make safer automobiles is a good one, because we should be looking at the purpose is really to think about what is most effective. And in the research process, of course, you have to justify your methodology. When you finally publish the results, that has to go through peer review as well from your peers. I've certainly, there's no perfect study, so I think it's a little bit, I think we have to be careful about saying that we have to then have a perfect study design, because unfortunately we can't randomize certain things where it may be unethical to randomize, where people may be put at risk, but we can advance knowledge and determine what is the best way to try to address the issue. I appreciate the opposition saying that they support good data, because if you don't mind, I have a bill that's about data and data compilation. It probably won't come to the Ed Committee, so I'm looking forward, and I hope that the NRA will also sign on to that bill, because that's merely a compilation of data, so that people will actually have the data, be able to do the research. That's not about bias or any conclusion. It's just about, let's compile the data the state currently compiles. But enough about that bill. I think in this case, there are processes in the peer review and the scientific process to address research, potential flaws in the research, addressing the questions to be sure that we are actually advancing our knowledge. But ultimately, what is most important about this bill, in my mind, is that we have a lot of discussion, a lot of rhetoric around guns on both sides. We are actually missing good science. And some of that, they're right, there isn't a direct prohibition on CDC, but there has been a chilling effect based on that, on the federal law. And also the idea that public funds, and I know Senator Monning brought this up, on a public health issue, traditionally it's been public funds that have been the core of trying to address public health issues. Whether you're talking about infectious diseases and contagions back, so safety, many other public health issues. And so the idea that the state of California, and hopefully later on the US government, doesn't actually play a critical role in trying to identify what the true risks and benefits or lack of risk isn't involved in that. I think it's concerning, because I mean there's a variety of issues that I've dealt with, not just around this, but even around things like toxicities and other types of things where the government plays the good broker and the neutral role in that, and I think this is an important step forward in doing that. So I'm proud to be a co-author of this bill. I think that it's very important, and I know the physician community in general, I won't speak for them, there's a medical association that does, but we've heard from the emergency physicians and the pediatricians that we want good data. This is not about taking guns away from people. This is about protecting public safety and having the information we need to know how to do it most effectively. If it shows that certain things aren't effective and those are onerous to gun owners, then let's remove those. If they're not going to keep people safer and they're just a hassle for gun owners, let's get rid of those. But there's also things that keep people safer. We need to have an honest public debate about how we strike that right balance to be sure we protect people's lives. And that's what this bill is all about, in my mind. And I want to thank you so much for bringing this forward.
Thank you, Senator. Thank you, Senator.
Senator Huff.
Thank you, Madam Chair. Senator Wolk, there is an existing UC Davis violence prevention research program currently run by Dr. Wintemute, which says on their website it's a multidisciplinary program of research and policy development focused on the causes, consequences, and prevention of violence. We place a particular focus on firearm violence and on the connections between violence, substance abuse, and mental illness. So you've already got an existing program focusing on the same thing you seek to be addressing here. Can you explain why that is?
Yes, I think Dr. Wintemute, as he explained in an article recently, has been putting his own money into this. I think this is a public health issue for all the reasons that Dr. Pan and Senator Monning said, and I think it's appropriate that it is the UC. Frankly, it should be the federal government through the CDC, but since it's not, it should be at UC, which is our premier research institution. And by the way, it won't be necessarily at UC Davis, although we love UC Davis and think they're wonderful. The bill makes it clear that it should be at UC, and it should be a process that is determined by UC as to where the appropriate place for a research facility should reside.
Thank you. And to that point, UC is constitutionally autonomous and generously funded, even though sometimes people don't think so, but they have a lot of priorities. Currently, looking at UCLA alone, they have more than 350 lab centers at UCLA. So they have chosen some things, many things that they think are important, and they do allocate resources to help do that. President Obama has issued an executive order back in 2013 basically asking the Department of Health and Human Services to telling them to conduct and sponsor research into the causes of gun violence and the ways to prevent it. And so you have a federal executive order from the president. You have CDC that's charged with public health issues, who, when they do engage, people don't like the results that they come out with. So, science being science. The language that seems to be getting people stirred up says, none of the funds made available in this title may be used in whole or in part to advocate or promote gun control. That didn't say anything about research. So I'm not sure that that hobbles that, or people should cower in fear that somehow this language from the Dickey Amendment is keeping them from researching this important issue. So eventually what I see here is a sole source contract and what appears to be an earmark for a local constituency. UCs have money, they can allocate it, they do allocate it, they have not allocated it sufficiently evidently for this, but why does that become our responsibility when that is what they do? They're a research facility. And then finally, I would say that Dr. Wintemute's a well-known gun control advocate. So how do you have somebody who has a known bias doing unbiased research? Now, scientific method aside, you get enough other peers that share the same bias, you're going to come up with a biased conclusion. So the question is, would you share equal funding with someone of the NRA's choosing for their unbiased research as well at the same institute? Is that something you would support?
I would support an effort at research that follows the guidelines that are set out by the National Institutes of Health and that academics who are engaged in research follow. And that includes transparency and peer review, and that is the essence of good research at a public institution, for all the reasons that Dr. Pan talked about. And I would also say that the Dickey Amendment, according to the author, who is a Republican, strong gun owner, his regrets are that this debate has become polarized. That there are those who want to melt down all the guns and those who want absolutely no regulation whatsoever. And in his view, this has had not simply a chilling effect, but an actual effect in limiting the kind of research that precisely should be done by the CDC.
Well, and I agree it should be conducted by the CDC, and so that begs the question why we're asking for it to be done here. But I'll let you address that in the close. There was a statistic cited about the firearm violence across the nation and how many that is. I would submit to you that we don't really distinguish, from what I understand of the data, between those who take their own lives and those that take other people's lives. And so perhaps our Death with Dignity bill that we recently passed will see those numbers diminish in California as they have other resources available to them. But I do find this. Let me just restate my conclusion and I'll close. UCLA and the UC system has plenty of these labs. The UC system has the money to fund their priorities. We have a lot of issues that crowd our agenda looking for funding at the state. This is something that can and should be done at the federal level. It's been issued executive order by the president. And I don't think it's appropriate to basically carve out something for one person's district. And I will oppose this bill. Thank you.
Thank you. You can have a small shot at it, Senator Pan.
Thank you so much, Madam Chair. Just as a former UC faculty member, I want to point out that while there are many research institutes at UC, many of them receive grants from a variety of sources, some from the federal government and so forth. The other thing is, while we've very focused on the Dickey Amendment, I would also point out that, unfortunately, Congress, which does, like our legislature at the state level, have authority over appropriations, has also, in addition to that one amendment, has also generally discouraged CDC from allocating money for this kind of research, not just through the amendment, but through its appropriations actions. So I think it's appropriate for our state, looking at our public health issues, to put funding to address a public health issue that in fact impacts Californians. Thank you.
Senator Hancock.
Well, I'm going to be in favor of the bill because I do believe that we need more research and more information and data. I just want to say I resent, on behalf of Dr. Wintermuth, who may not comment on it, a tactic that we often see in environmental research, which is to discredit the researcher because they come up with a conclusion that you don't like. I do not consider Dr. Wintermuth particularly a gun advocate or whatever, one way or the other. He's given us data on the kinds of gun injuries that that gun owners face. And to me, one of the most interesting conclusions was that to own a gun was 5 times more likely to be used either in the accidental shooting of a family member or someone else, or in suicide, than in fending off an intruder in the home or whatever. And I think if people don't agree with research results, they ought to talk about why that research is incorrect and not imply that there's a bias in the researcher. So are you going to close, or can we move the bill as amended?
Well, first of all, there are two things. I, too, am going to support the bill. Will you take the amendments?
Oh, yes, I will. Thank you, Madam Chair, for reminding me. Indeed, I do accept the 2 amendments.
Accept the amendments. Okay. And so I will look forward to a motion on the bill.
So moved.
Senator Hancock moves the bill.
Okay.
Senator Wolk, would you like to close?
I will. I will briefly close. Thank you for the discussion and for all the issues that have been raised. It is true indeed that the University of California has many priorities for research. This bill is here because it should be our priority, the state's priority. There are deaths and injuries from gun violence in many ways, and it's important that since the federal government is not going to do that, the research necessary, and does not appropriate funding to this, that we should, with our excellent public university system, bring it here. Frankly, we will be performing an excellent need, meeting an excellent need for the entire country, but certainly for our state. The numbers of people who are injured and killed each year is just appalling, and research can point the way to better policies to reduce or eliminate perhaps some of them. Again, UC will be the place where this will be decided by the regents and the president, and they will choose through a process, as they usually do, for the location of this center. So I would ask, with that, I would ask for your aye vote.
Okay, if the bill has been moved as amended, this is a double referred bill to public safety. Let's call the roll.
This item 3, SB 1006, the motion is do pass as amended to public safety. Liu? Aye. Liu, aye. Block? Aye. Block, aye. Hancock? Aye. Hancock, aye. Huh? Huff, no. Leyva. Aye. Leyva, aye. Mendoza. Monning. Monning, aye. Pan. Aye. Pan, aye. Vidak.
No.
Vidak, no.
6-2, the bill is out. We'll keep the roll open for an absent member.
Thank you, Madam Chair.
Thank you
members.
very much. Senator Allen.